Okay, so today we're going to go through how to tape a patellofemoral joint. Importantly, how to tape this to control lateral tracking of the patella. So we're going to try and improve our medial glide using tape to fix it. We're also going to do a taping technique to take some pressure off our infra-patellar fat pad, or the bursa below our kneecap. So to start with, we need to make sure that we use some low allergy tape underneath. So Hyperfix or Fixamol. MeFix is another brand. The reason we use this is to protect the skin, prevent irritation and rash development, but also to use as an anchor for us to put our tape on. So we pre-cut some pieces here which we've gone the length of the inside of the thigh to the outside of the thigh over the top. And what we're going to do is we're going to put the first piece over the top half of the kneecap. So we lay this down like so. And then we're also going to put a piece just below that, so just slightly overlapping. So we lay that down again, just like so. So we get some overlap here, and what this does is this will protect the skin and allow us to try and glide this patella or kneecap towards the inside. So we're going to use rigid tape for this purpose. You can use other tapes such as K-tape. Rigid tape tends to give a little bit better purchase when you use it. So what we do is we rip or pre-cut some pieces. If we find the patella or the kneecap, and what we want to do is we want to make sure that we put this tape towards the top half of the kneecap. So if we draw a line at the top and we draw a line at the bottom, we want to ensure that we get the tape towards the top half, so that what we do is we actually tip the kneecap out of the bursa below here, which is often a big source of symptoms in people with patellofemoral pain. So we're going to lay our tape down here, slightly towards the top. And what we're going to do is we're going to bring the kneecap across towards the inside. We're going to bunch up the skin on the inside and lay the tape down. And what you'll see is some skin bunching here. And if we're seeing that skin bunching, we're on the right track. Now, your therapist should be able to tailor this taping a little better depending on different positions of your kneecap, and they can discuss this with you during treatment. But what we're going to go through today is just a simple way of doing that. And all we're focusing on is just trying to move the kneecap towards the inside of the knee. So we're going to put 3 pieces of tape all together to control this. The reason we put 3 pieces of tape is so that we've got some really good support, because if we rely on one, the chances are what will happen is that the tape will come loose and we'll lose the effect of the tape. So we lay that down and you'll see some nice bunching through here. Now you can adjust this depending what's comfortable and also what gives you the most pain relief. Now if we were to stop the taping here and we just do the medial gliding, what we would then do is also we would put some tape over the tapes that we put on, just to control it and to hold it in place. So we'll lay that on here, and then we do very similar on the outside. Once you've done this taping, ensure that you bend your knee to make sure that you've got full range. So we slide the knee forward, and what will happen is the tape will peel a little bit, and just lay that back down, and then make sure we can straighten again, and check that you've actually reduced the pain. So do a squat again, or do some sort of exercise like a step down or a step up to see if you've reduced the pain. If you haven't, you can play around and try and adjust the tape a little bit further. The second part of the taping we're going to do is to try and control, or to try and support, the bursa below the kneecap, which is called our fat pad. So we're using the same lengths of tape, which I've pre-cut already. And what we're going to do here is we're going to go from a little bony point we call our tibial tuberosity. So if we come down from the end of the kneecap and we palpate and push down, you'll feel a bony end point, which is where the tendon goes in. We find that point and we go just below it. And what we do is we bring the tape up towards the outside of the knee. So it's overlaying the outside of the knee, and we lay that down. And then we do the same thing on the inside of the knee. So again, this tape here with the white tape is just to protect the skin. So we're not actually trying to do anything in terms of mechanical change here. So again, we lay this up towards the outside. So this will give us some purchase for our rigid tape to control things. So what we do now is we take a couple of pieces of rigid tape, and you can do 1 to 2 pieces of this. And what we do is we slide the skin up, and we bring the skin down, and we lay that down here. And then we do the same thing on the inside. And what you'll see is that the bursa below the kneecap starts to bunch up and starts to look really fat. So what we're doing is we're taking all the tension away from that. So you don't always need this part of the taping, but if you've got some inflammation around here, it can be very useful to reduce the pain during a number of tasks. So then we bend the knee to make sure we've got good movement, and we do. If we don't, we can peel the tape back a little bit and lay it back down. And then what we want to do is we want to anchor it back down again over the top. So nice long piece, and lay that down. And then I'm quite paranoid, so I like to anchor my anchors. So we'll also do that. So we'll put another piece of tape here over the top and another piece of tape on the inside, like so. So we lay that down. So taping is something that takes a little bit of time to practice, but once you've got it mastered, that's actually quite easy to do. And this taping here can help us to do a lot more exercise and rehabilitate our knee, particularly if we're finding that our exercise rehabilitation has been prescribed to us is quite painful. So I'm going to go ahead now and do some of my exercises with hopefully a lot less knee pain.